Welcome back to the channel. If you're new here, we focus on practical, evidence-based health information specifically for adults over 60, because your body deserves honest answers, not clickbait nonsense. So let's talk about something that doesn't get nearly enough attention: poor leg circulation. After the age of 60, your blood vessels naturally lose some of their elasticity. Think of a garden hose that's been left out in the sun for 10 summers. The rubber gets stiff. It doesn't flex the way it used to. When you squeeze water through it, the flow isn't as strong, and sometimes it kinks in places you wouldn't expect. That is a rough but useful picture of what happens to your arteries and veins as you get older. The walls thicken, plaque, which is essentially a buildup of cholesterol and calcium, narrows the interior passage. Blood that once moved briskly through your legs now moves like traffic through a bottleneck. The medical term for this is peripheral artery disease, or PAD. And here's the number that should make you sit up straight. According to the American Heart Association, approximately 8 to 12 million Americans have PAD, and the overwhelming majority of them are over 60. Many don't even know they have it. They assume the cramping is arthritis. They assume the cold toes are just poor thermoregulation. They assume the slow healing scrape on their shin is a skin issue. It's not, it's a circulation issue. And left unmanaged, poor leg circulation can lead to chronic pain, dangerous blood clots, non-healing wounds, and in the worst cases, tissue death that leads to amputation. I don't say that to frighten you. I say that because knowledge is the opposite of fear. And today's knowledge is remarkably hopeful, because nature handed us a tool that addresses this problem from the outside in. A specific oil with vasodilatory, anti-inflammatory, and blood-thinning properties that, when combined with targeted massage, creates a 1-2 punch for sluggish leg circulation. Let me introduce you to that oil right now. The oil is warm sesame oil. And before you wrinkle your nose thinking about stir-fry, let me explain why this particular oil has been used medicinally for thousands of years and why modern science is finally catching up to what Ayurvedic practitioners understood long before clinical trials existed. Sesame oil, specifically cold-pressed, unrefined sesame oil, contains a compound called sesamol. Sesamol is a powerful antioxidant that protects blood vessel walls from oxidative damage, which is one of the primary drivers of arterial stiffness. A 2013 study published in the Yale Journal of Biology and Medicine found that sesame oil consumption and topical application were both associated with reductions in blood pressure and improvements in lipid profiles in hypertensive adults, many of whom were over 55. But sesamol isn't working alone. Sesame oil also contains high concentrations of linoleic acid, an omega-6 fatty acid that, when absorbed through the skin, helps reduce localized inflammation in the blood vessel lining, that thin interior layer called the endothelium. When the endothelium is inflamed, it swells inward, further narrowing the passage for blood. Linoleic acid calms that swelling down. There's a third mechanism too, and it's the one most people don't know about. Sesame oil has a natural warming quality at the molecular level. When you massage warm sesame oil into the skin of your legs, it penetrates the dermal layers and causes mild vasodilation, meaning the tiny blood vessels near the surface physically relax and widen. More space means more flow. More flow means more oxygen reaching the muscles, nerves, and tissues of your calves, shins, ankles, and feet. Now, can you use other oils? Yes, and I'll mention a couple of excellent alternatives in a moment. But sesame oil sits at the top of the list for 3 reasons. Its absorption rate through human skin is exceptionally high compared to olive or coconut oil, its antioxidant profile is specifically suited to vascular health, and its viscosity, its thickness, is ideal for massage without being so heavy that it clogs pores or so thin that it evaporates before doing any good. Let me walk you through exactly how to do this massage, step by step. You'll want to do this in the evening, about 30 to 45 minutes before bed. There's a reason for the timing. During sleep, your body enters its most active repair cycle. Growth hormone peaks, inflammatory markers drop. By massaging the oil in before bed, you're essentially giving your circulatory system both the raw materials and the mechanical stimulus it needs right before the window when healing is most efficient. Step 1. Warm the oil. Pour roughly 2 tablespoons of cold-pressed sesame oil into a small glass bowl or cup. Set that cup inside a larger bowl of hot water, not boiling, just comfortably hot, for about 2 minutes. You want the oil warm to the touch, like bath water. Never microwave the oil directly, because microwaving destroys sesame at high temperatures and creates uneven hot spots that could burn your skin. Step 2. Elevate your legs slightly. Sit on your bed or a comfortable chair and prop your feet on a pillow so your legs are angled gently upward, about 15 to 20 degrees. This position uses gravity to assist venous return, which is the flow of blood back toward your heart. You're not fighting gravity anymore, you're working with it. Step 3. Start at your feet. Dip your fingertips into the warm oil and begin at the soles of your feet. Use your thumbs to press in small, firm circles along the arch, from heel to the ball of the foot. Spend about 60 seconds on each foot. This area contains dense networks of capillaries and nerve endings. Stimulating them sends a signal upstream that dilates the vessels in your ankles and lower calves. You might feel a gentle warmth spreading upward almost immediately. That warmth is blood moving. Step 4. Move to your ankles and calves. Wrap both hands around one ankle and use long upward strokes. Always upward, toward the knee, never downward. This is critical. Downward strokes push blood away from the heart and can worsen venous pooling. Upward strokes mimic the direction your venous blood needs to travel. Apply moderate pressure, firm enough that you feel the muscles underneath respond, gentle enough that it never hurts. Spend about 2 minutes on each calf, alternating between long sweeping strokes and shorter kneading motions where you press your thumbs into the belly of the calf muscle and roll outward. Step 5. Address the area behind your knees. This is a spot many people skip, and it's arguably the most important. The popliteal fossa, that soft hollow behind your knee, houses the popliteal artery and vein, major vessels that feed your entire lower leg. Using your fingertips, apply very gentle circular pressure here. Not hard. Think of it as coaxing, not forcing. 30 seconds per knee is plenty. If you feel a pulse under your fingertips, that's a good sign. It means those vessels are open and responding. Step 6. Finish with the thighs. Using broader, flatter strokes with your whole palm, sweep the oil from just above the knee all the way up to the hip crease. The femoral artery runs through here, and these long strokes encourage systemic flow through the largest vessel in your leg. About 90 seconds per thigh wraps this up nicely. The entire routine takes between 10 and 15 minutes. That's it. And by the time you pull the covers over your legs, the oil will have absorbed almost completely, leaving your skin soft and your circulatory system primed for a night of deep restorative work. Now, for those of you who want to amplify the results, there are a couple of additions worth considering. Adding a few drops of cypress essential oil, 3 to 4 drops mixed into your sesame oil before warming, can significantly boost the vasodilatory effect. Cypress contains alpha-pinene, a terpene compound that relaxes smooth muscle tissue inside blood vessel walls. The scent is clean, woody, slightly evergreen. It's pleasant rather than medicinal. Rosemary essential oil is another excellent addition, particularly if your circulation issues come with significant muscle cramping. Rosemary has been shown in a 2016 study published in Evidence-Based Complementary and Alternative Medicine to increase local blood perfusion, that's the actual volume of blood moving through tissue, when applied topically with a carrier oil. 2 to 3 drops per tablespoon of sesame oil is the right ratio. One important caution here, if you're taking blood-thinning medications like warfarin, heparin, or even daily aspirin, talk to your doctor before adding rosemary oil, as it may slightly enhance the anticoagulant effect. Sesame oil on its own, used externally, is considered safe for virtually everyone, but the essential oil additions warrant a quick conversation with your healthcare provider, just to be thorough. If you're over 60, or if you're caring for an elderly parent, spouse, or loved one who complains about heavy legs, cold feet, nighttime cramping, or numbness, this information genuinely could be life-changing. I'm not exaggerating. Something as simple as a 15-minute oil massage before bed, done consistently for 2 to 3 weeks, has helped thousands of people feel measurable improvement in how their legs feel throughout the day. And the beauty of it is that there's no prescription required, no expensive equipment, no side effects, just oil, warm hands, and a few minutes of intention. Take a second right now and hit that subscribe button if you haven't already. We put out videos like this every week. Honest, practical health guidance for people who've earned the right to feel good in their own bodies. And if someone you love could benefit from hearing this, share this video with them. Sometimes the people who need help the most are the ones who'd never search for it themselves. Let me set honest expectations because I never want to promise you a miracle and hand you disappointment. During the first 3 to 5 days, most people notice improved skin texture on their legs and a subtle warming sensation that lingers after the massage. Sleep may improve slightly because better circulation reduces the restless, achy feeling that keeps many seniors tossing through the night. By week 2, the more significant changes tend to appear. People report that the tingling and numbness they used to feel first thing in the morning is either reduced or gone entirely. Walking distance before cramping sets in may increase, sometimes noticeably. The color of the skin on the feet and lower legs often shifts from a pale, slightly grayish tone to a healthier pink. That color change is visible, objective proof that more oxygenated blood is reaching the surface tissues. By week 3 and beyond, the cumulative effect of nightly massage combined with sesame oil's antioxidant protection begins to influence the health of the blood vessel walls themselves. You're not just temporarily widening the vessels anymore, you're actually reducing the oxidative damage that made them stiff in the first place. This is where the long-term benefit lives. Consistency matters far more than intensity. The oil massage is powerful on its own, but pairing it with a few simple daytime habits turns it into something genuinely transformative. Ankle pumps. While sitting, watching television, reading, whatever you're doing, flex your feet up toward your shins, then point them down toward the floor. Do this 20 times, 3 times throughout the day. Each pump activates the calf muscle, which acts as a biological pump that physically squeezes venous blood upward. Vascular surgeons call the calf the second heart for exactly this reason. Hydration. Dehydrated blood is thicker blood. Thicker blood moves slower through narrow vessels. Aim for 6 to 8 glasses of water daily. If plain water bores you, add sliced cucumber or a squeeze of lemon. The goal is simply to keep your blood at a viscosity where it flows instead of sludges. Leg elevation during the day. Even 15 minutes with your feet propped above heart level lying on the couch with your ankles on 2 stacked pillows gives your venous system a gravitational assist. Do this once midday and once in the evening before your massage. Short walks. Even 10 minutes of walking activates every major muscle group in your legs and forces rhythmic contraction that propels blood through vessels mechanically. You don't need to power walk. A gentle stroll around your living room or down your driveway counts. Movement is movement. Your blood vessels don't care about your step count. They care that you moved. Self-care is wonderful, and this oil massage technique is safe and effective for the vast majority of seniors. But certain symptoms should send you straight to your doctor, not to your kitchen cabinet. If you notice sudden swelling in one leg but not the other, especially if it's accompanied by warmth and redness, that could indicate a deep vein thrombosis, a blood clot that requires immediate medical attention. Do not massage a leg you suspect has a clot. Massage could theoretically dislodge it. If you develop wounds on your legs or feet that refuse to heal after 2 weeks, regardless of how minor they seem, get them evaluated. Non-healing wounds in the lower extremities are a hallmark of advanced peripheral artery disease and may need professional treatment. If you experience sudden, severe pain in your calf that comes on without exertion and doesn't resolve within a few minutes, call your doctor that day. Not next week, that day. These situations are uncommon, but mentioning them matters because I'd rather you know the red lines than stumble across one unprepared. Let's bring this all together. Poor leg circulation is one of the most common, most dismissed, and most manageable health concerns facing adults over 60. The numbness, the cramping, the cold feet, the heavy feeling, none of it is something you have to accept as an inevitable part of aging. Warm sesame oil, applied through a simple upward stroke massage technique each evening before bed, delivers antioxidants directly to your blood vessel walls, reduces localized inflammation, promotes vasodilation, and mechanically assists blood flow through the very vessels that need it most. Adding cypress or rosemary essential oil enhances the effect. Pairing the massage with ankle pumps, hydration, brief daily walks, and leg elevation multiplies it further. 10 to 15 minutes each night, no prescription, no equipment. Just your hands, warm oil, and the decision that your legs, the legs that have carried you through 6, 7, 8 decades of a life worth living, deserve better than neglect. You showed up today because something about this topic resonated with you. Maybe your legs ache right now as you watch this. Maybe you watched someone you love struggle to get out of a chair because their legs felt like concrete. Whatever brought you here, I'm glad you stayed, because now you have something you didn't have 15 minutes ago, a plan. Start tonight. Warm the oil, sit down, begin at the feet, stroke upward, be patient with yourself, and in 2 weeks, when you swing your legs out of bed and your feet hit the floor and the tingling isn't there anymore, remember this moment. Remember that you chose to do something about it. If this video helped you, tap that like button. It tells the algorithm to show this to other seniors who need it, and that costs you nothing but a single click. Subscribe to the channel so you never miss our weekly videos on senior health, mobility, nutrition, and longevity. And drop a comment below. Tell me, do your legs bother you at night? Have you tried oil massage before? I read every single comment, and your experience might be the thing that convinces someone else to give this a try. Share this video with a friend, a sibling, a parent, send it in a text, post it on your Facebook. The people who need this information most are often the ones who'd never think to look for it. Take care of those legs. They've carried you this far. Give them a reason to carry you further. I'll see you in the next one.